pill or a patch that's, or a IUD that is hormonal, that's a big deal. Liam?
So for women that are like perimenopausal, HRT, I feel like has become pretty popular in recent years.
Yeah.
Is that like just estrogen and not the progestin as well?
Yeah, I think it's basically estrogen hormone therapy, yeah, to increase estrogen. That is part of this chapter, technically, we just have not gotten to that. Jolene?
It says that it secretes small amounts of estrogen and progesterone. It's still like stimulating then the GNHR then, right? A little bit, but just not enough to cause this whole cycle to start.
Correct.
Okay.
So it's never like shutting, we talk about shutting the cycle off. It's never actually doing, it's just dropping the levels enough that it's not sufficient to bring on ovulation. So everything is like not black and white, not on or off, binary. There's just not enough of it. Okay. So in the information about this birth control or through tricyclic, it mentions that the hormones in the pill make cervical mucus thicker and stickier. Does this happen during my during my natural cycle?
Yeah.
What's that?
Mucus plug.
Yeah, well, yeah, it does happen during your natural cycle, right? It does, okay? So my doctor explained the birth control pills trick the body into thinking it is pregnant. She explained that women do not normally ovulate when they are pregnant. Can you explain to me why a pregnant woman does not ovulate? So there's two ways to approach this question. It's like, why wouldn't, like, logically a woman ovulate when she's pregnant is one way to approach the question. And the second one is, what are the actual chemical processes that stop ovulation from happening? Yeah.
Can we go back to 4? Because did we answer how are estrogen and progesterone involved in the cervical mucus?
It would be over here is when we have high, especially progesterone, that these glands end up producing more glycogen and other molecules, and the cells get thicker and plumper, and so you have thicker mucus here.
Isn't it the other way around? Like,
Where
because you're maybe I'm thinking of
we're thinking of preparing for implantation.
yeah, because you have to have it thin so the sperm can pass through. Whereas in the beginning of the cycle, you want it to be thicker because you're trying to prevent, right? So would estrogen be more?
So, when it's ovulated, like right here, all of that mucus is thinner, and this is where we want the sperm to be coming. If the sperm is coming at this stage, it's already too late for it to get to the ova or to the oocyte. So that's a little confusing in the overlap of the timing there. So I guess the most important thing is that, what is the most important thing?
Would it be like the increase of estrogen in that end phase is actually what thins it out a little bit, and then the progesterone kicking in?
Yeah, I'm just trying to think of how we want to summarize it to make a point for this particular question, because
Is this gonna be a question on the exam?
no.
Then we don't care.
Well, but I do want you to know that higher estrogen progesterone in the second half of the sexual cycle that you see after that line there does stimulate the plumping and glycogen secretion of the endometrium. That's really important. One second. Do I have this posted on the So I did make a key for this. I didn't make a key for the other one because I just didn't have enough time. But I do have a key for this one. So I will go ahead and post it. I just wanted to remember what I, wanted you to focus on. And it's just that it is during the first 14 days of the cycle, when your endometrium is thinner and there is less mucus, cervical mucus, it does make it easier for the passage of the sperm. However, post-ovulation, you have increase in the thickening of the mucus, which is related to preparing endometrium for implantation. We haven't talked about fertilization explicitly yet, and that is why it's hard to connect those dots. But there is a very small window before the mucus is too thick for both the endometrium to be super ready and for implantation to be able to happen. So maybe you don't read into that one very much at this point. What about this tricking your brain because you have tricking your brain to thinking your estrogen is low? How does that deal with the feedback, negative feedback mechanism? Liam?
Well, the Clomid, I think, blocks the majority of the estrogen receptors in the anterior pituitary. So more LH and FSH is secreted to stimulate the ovulation cycle.
Yeah, remember where I had mentioned that at low estrogen level, you have at least high production of FSH and LH and high release of FSH to stimulate the follicle. But at high estrogen, basically think of it like this. High estrogen means you already have plenty of follicles that are developing because that's what caused high estrogen to be there in the first place. So you don't need to stimulate more follicles to be developing. So high estrogen will shut down the release of gonadotropins from anterior pituitary, whereas low estrogen increases gonadotropin release from anterior pituitary to stimulate more follicles. Liam?
So am I right to assume that Clomid would also increase fertility in males and increase testosterone?
That is an interesting question. I'd have to think about that. It's like going to some location I've driven to many times from a totally different place. I'll think about it. It's an interesting question. Because it is, we do have all these analogous structures in the male. So we just have a few minutes. My doctor told me if I take Clomid, I would be taking it on days 5 through 9 of my normal menstrual cycle. She explained this is when the greatest chance of stimulating the ovaries is. What is going on during this time?
It's right before ovulation.
Yeah.
It's kind of resyncing tissue cycles, right? Ovarian and the menstrual cycle.
Well, most importantly, it increases this transition from developing, here we call them secondary, but these follicles into plenty of these tertiary and eventually mature follicles. We're gonna grow all these antral follicles, 5 through 9. Of course, there's a delay, so you have a few days before ovulation for more follicles to develop. And finally, that last question is saying, I read somewhere online that multiple pregnancies are more likely when people are on Clomid. Does that make sense to us?
Yes, because we have an overabundant amount of FSH and LH, so the eggs can more immature.
Yep, we have an abundant amount of hormones, especially FSH, that can stimulate the whole cohort, right, potentially 6 or more follicles to mature and become big enough to potentially be able to ovulate. And if they do, then that means that multiple oocytes are going to be released at the same time. And if there is enough, or if there is sperm in the tract, it's likely that multiple will get fertilized.
So could you have a case where someone gets pregnant and they have